Good evening. Welcome to the white coat ceremony for the class of 2025. I am Dr. Janet Dolott, Interim Chair of the Department of Physical Therapy. If everyone would please stand. And I would like to invite Rabbi Fogel, Rabbi of Touro University, to present the invocation for our ceremony.
Avinu Shabbat Heavenly Father, bless all of those who have joined us here today, whether live or virtually, to take part in New York Medical College Department of Physical Therapy white coat ceremony for the class of 2025. Almighty God, Rofeichol Basaro Maflila Asos, healer of all flesh and wondrous in your acts, you have instructed and empowered humanity to provide relief, comfort, and aid to all of your children. We and all who are involved in the citadel of medical education are your agents in this task. May your abundant blessings be showered on all those who enter the halls of this institution. Give strength, courage, fortitude to the women and men who now prepare to engage in direct patient care. Bless them as they act as your agents to serve those in need, those in pain and discomfort, and all those who seek their healing. Grant them the wisdom and the strength to strengthen the weak and uplift those in despair. As our students begin the actualization of the knowledge that they have acquired, we pray that they constantly remember the principles to which they were educated. May they always recognize each and every patient as the individual that they are, and grant them the ability to always acknowledge the interplay of body and spirit in the art of physical therapy. At this auspicious event, we pray to you, dear God, that you shower your blessings upon the students and their loved ones, parents, spouses, children, and other dear ones who have helped them reach this milestone, who have been there for support and encouragement so that they can be here today. May God bless administration, faculty, and students of New York Medical College and grant them the wisdom, resolve, and fortitude to continue their noble mission of educating the next generation of caregivers. Touro University was created to serve, strengthen, and improve your world, dear God. We ask for your continued divine guidance so that no matter the challenges or circumstances, we together can stand and continue to better your world. Amen.
Thank you, Rabbi Fogel. Everyone, please sit. So many of you may know that the white coat ceremony is a rite of passage for students entering doctoring professions. The white coat symbolizes clinical knowledge, professionalism, and responsibility. This ceremony signifies the students' transition from purely campus-based coursework to participating in clinical education experiences, where they will work with real patients. So this evening, to mark this occasion, our school's leaders, faculty, and an alumnus will offer words of wisdom to the students. This will be followed by the donning of their white coats and recitation of the PT pledge. So to continue with words of wisdom, or to begin with the words of wisdom, I would like to introduce Dr. Edward Halperin, MD, Chancellor and Chief Executive Officer of New York Medical College, to offer some words.
Good evening, everyone. officers of the School of Health Sciences and Practice, members of the faculty, family and friends, and my dear young physical therapists. It seems to be customary on occasions like this for someone to trot out some gray-haired person with a lofty administrative title, put them in front of you, and tell them to say a few words. Dr. Delott just did it. She just said, I am, quote, to deliver some words of wisdom, close quote, or quote, some words. She picked me for this duty. I, however, think there's a great deal of difference between saying a few words and actually having something to say. Let us, therefore, this evening dispense with the standard speech by the gray-haired administrator about how you've gotten your white coat. You've now caught the brass ring on the merry-go-round of life. Soon they'll call you doctor, and hurrah for all of us. Instead, there are two serious matters I want to talk with you about this evening. They are both ethical problems. The first is the ethical problem of the so-called third person in the examining room. You're going to go to a set-aside examination space. You're going to take a medical history, and you're going to do an assessment, and you're going to formulate a proposed plan of treatment. You're going to develop a physical therapist-patient relationship. It is going to be presumed to be confidential. The patient assumes that you are making a recommendation in their best interest. As far as the patient knows, there's only two people in the examination space, them and you. But often, there's a third person in the room. The third person may or may not be visible, but whether they're clearly visible, they're there nonetheless. And the presence of this third person influences what happens between you and your patient. Who is this third person or entity intruding upon the two-person physical therapist-patient relationship? Maybe it's your boss who wants to be sure there are enough billable units of care being administered to increase the profitability of the practice. Their influence may prompt you to recommend interventions which are not necessary, but are billable. Maybe the third entity in the room is your student loan debt, or your mortgage, or your desire for a new car or a computer at home. Maybe you'll be on an incentive compensation model at your practice, and you know that the more billable interventions you order, the more money you'll see in your paycheck. Or maybe you'll decide to put one patient on the TENS unit or under a hot pack or a cold pack. That'll keep them occupied while you work on another patient over there. Then you can collect 2 for 1. Maybe the third entity is your desire for an academic promotion, and you're motivated to sign up a patient for a clinical trial, which really isn't appropriate, but you got to reach the right end to get the study to a place where you can publish it. Maybe the third person's the person from the billing office. They tell you that your patient's approved for 10 sessions. It doesn't matter if you think they only need 5. They just told you to stretch it out for 10. We need to keep these clinic slots filled, you know. Maybe the third person's the patient's relative who tells you that if you can find a way to fill out that form this way rather than that way, the patient's going to get approved for a disability payment or a better insurance company settlement. So my first message this evening is when the patient thinks there are 2 people in the room, but there's actually 3. And if the motivation of that third person isn't in the patient's best interest, and the patient doesn't know about it, but you do, then you're a party to a deception. So I advise you, as you don the white coat, to be cognizant of that risk. Guard your conduct, young physical therapist, lest you impale your principles upon it. The second serious matter I want to discuss with you this evening is the problem of evidence. As a pediatric radiation oncologist earlier this week, I was asked to recommend a course of treatment for a 4-month-old child with stage C Wilms tumor of the kidney. I know the indications for radiation therapy. I know the size of the radiation beam required, and I know the dose. How do I have the audacity to use the verb know? Well, I actually do know. And I know because of multiple randomized prospective clinical trials, which have taught me how to achieve the highest probability of local tumor control and survival. Now, contrast that with a lot of physical therapy. How much of what you were taught to do clinically is defensible on the basis of research in animal models? Translation of that research to humans, randomized prospective clinical trials, and long-term follow-up. What do physical therapists really know about the optimum dose of most of their interventions? Perhaps the specialty of physical interventions attracts people who trust their intuition. Perhaps. But intuition is not evidence. Any patient who is aware of the standards of evidence-based medicine will quickly recognize that I recommend exercises in water, or I recommend exercises in the gym, or I use ultrasound, or TENS, or dry needling, or deep tissue pressure, and I do it for 3 or 5 or 10 or 20 sessions, isn't science. It's empiricism. Now, the problem, of course, is not confined to physical therapy. No doubt some psychiatry would benefit from a dose of evidence-based medicine, as, of course, would the nonsense of alleged spinal manipulation, attributing all disease to bone manipulation or acupuncture. So this evening, let me remind you of 2 wise proverbs. 1, in the clinic, the plural of the word anecdote is not data. In the clinic, the plural of the word anecdote is not data. This is the way I do things, or I have had success with this technique. Those may be statements of fact, but they're not defensible data. And second, a clinician can do the same thing wrong for 30 years and call that 3 decades of clinical experience. So I hope that some of you as you don the white coat this evening, will choose to commit yourselves to transforming physical therapy into an evidence-based discipline. I am happy to welcome you to that body of women and men in white coats, stretching backward and forward in time, who have committed themselves to the relief of pain, the amelioration of suffering, and to helping people avoid, to the extent possible, premature death. I wish you all Godspeed on this next part of life's journey. Thank you.
Thank you very much, Dr. Halpern. I would like to now introduce Dr. Robert Amler, MD, Dean, School of Health Sciences and Practice, and Vice President for Government Affairs at New York Medical College.
Good afternoon/evening, and hello, class of 2025. Hello. Dr. Halpern gave us some very, very thoughtful advice, a very important perspective on the aspects of clinical care. This evening's event is all about making that transition from a bright, precocious student of science and applied science to actually becoming the clinicians that we all strive to perfect and be. And to have our family and friends here to see it happen makes it extra special. So hello, family and friends, and welcome to New York Medical College. The faculty have heard me say some of these things before, so if you see them covering their ears, you understand why. But the fact is, we all have lots of friends. We've had lots of friends growing up. We talk about, what do you want to be? What are you going to do? What is your goal in life? And you'll hear a lot of people say the same refrain. I want to make a difference, right? Have you heard people say this? I want to make a difference. I want to make a difference. However they say it, everybody wants to make a difference. The difference is, with the education you're getting here, you really will be in a position to make a difference. The faculty are nodding because they know physical therapists really do make a difference. I can personally attest to this. You may have noticed I had a slight limp walking up to the lectern just now, okay? One exam grade given back to you if you don't like it, if you can identify what body part was causing that slight limp. I'll bet you can't, but anyway, we'll see. So to make a difference, you know, this is all going to begin with your education, with your preparation, with the training. It's what you're doing now. It's often been said, physical therapy can lead you to a job. But what goes beyond that job? Would you also call it your profession when you get there? I hope so. For many people, you'll say, this is my profession. It's also my career. And the career has a longer term connotation, doesn't it? But really, for many of us, and I wear this white coat just like you, for many of us, it's more than a job. It's more than the profession or even your career. It is a calling to show those around you that you not only can make a difference, you not only will make a difference for your patient, your client, but in fact, you have committed to making whatever difference is possible for that person in that two-person encounter that Dr. Halpern described. So I salute you for taking this step, for making this commitment to putting on this white lab coat, which by itself is just some nice, clean piece of cloth. But what it symbolizes is you are a professional, you are a careerist, and for many of you, this is your calling. And when this white coat is worn, it signals to everyone around you that you are someone who is committed to making a difference to whoever is brought in front of you for help. And you are there to help, and you always will help. I thank you. I congratulate you. Dr. Halpern called you our dear new physical therapists, and I share that sentiment. You are dear to every one of us because of the commitment you are making. And I'm very happy to say congratulations and best of luck. I'll see you in your white coats very shortly. Thank you.
Thank you, Dr. Amler. I would now like to invite Dr. Ben Johnson, PhD, Vice Dean of the School of Health Sciences and Practice.
Well, welcome, everyone. Dr. Delott, I think a serious mistake has been made. I've been through the lobby many times, and I've even been in the classroom with some of these guys, and I don't recognize any of them. This group is way too well dressed for what I'm experienced with. But seriously, I was very excited this morning to get dressed, and I got my white coat a long time ago. So I was rummaging through the closet trying to find my white coat. And much to my dismay, I found that my white coat, much like my hair, had kind of turned gray. I don't have a white coat. I'm just a lowly biomechanist. But what I would say to you is congratulations. You have survived anatomy. You've survived physiology. You've survived exercise science. You've survived neuroscience. It's all downhill from here. Now I'm looking at your faculty and they're going, well, maybe not so much, but anyway. No, in all seriousness, congratulations to you. You have worked hard to get where you are. You have managed to be enrolled in a program that is incredibly competitive. I say that having been a few years ago a department chair in the state of Kentucky of kinesiology and health promotion, and I literally had 900 undergraduate exercise science students. And I would estimate that about 80% of those 900, so over 700 students, if I asked them what they wanted to do after they graduated, they would all say, I want to go to PT school. Or maybe a few would say PA school, maybe some would say OT, but the vast majority wanted to get in PT school. And it broke my heart to have to say to them, and I also headed one of the programs that sort of prepared them for the next steps, to say, your chances are not very good. Your chances of getting in med school might be as good as your chances of getting into PT school. But regardless, you guys made it. And you survived that first year, or almost first year. So congratulations to you. If at any time I can be of help to you, if I can give you some counseling and biomechanics, I'm happy to do so. So congratulations.
Thank you, Dr. Johnson. So now we're going to move to the faculty address. So to deliver the faculty address, I would like to invite up Dr. Scott Rivera, PT, D.P.T. Wow. EDD, Assistant Professor of Physical Therapy, and I'll stop there.
Thanks. All right. Thanks, Dr. Delott. Yeah, everybody's looking like, man, I got to listen to this guy all day. Now I got to listen to it at nighttime too. This is ridiculous. So no, I'm very glad to have the opportunity to offer a few brief words here tonight. You all have me in class, brevity is not my forte, but I'll do my best. So as you all complete your third semester and start to kind of think about getting into the clinic, I'd like to share some ideas that you might be able to bring with you to help you along the way, not only as you go into the clinic, but continue your education and kind of take with you into your lives and your professional lives. So there's three attributes I think are important to have success. They're not the only three, but three attributes I think are important to have success, both in your personal and your professional lives, as you begin this next phase of your training. The white coat is a symbol for what you've worked to achieve and gives you and those who you interact with a level of trust, a level of comfort in your abilities and kind of that you're there to help them. Donning the white coat, physically or proverbially, will be the impetus for rewarding experiences beyond what you could possibly imagine. But with this comes a responsibility to your patients, to your local and global community, to your colleagues, and to yourself. It's said that with great power comes great responsibility. And it said that, and some people like that one. And they also say that knowledge is power. So using kind of some basic application of the transitive property, we can say that with great knowledge comes great responsibility. And having worked with all of you this semester, I feel confident that you'll be able to handle that responsibility. But what I'll talk about today are some things you can bring with you in the clinic to help you with that. So the first that you should bring is resilience. So in physics, resilience is the ability of a material to respond and regain its shape after being deformed by stress. In life, resilience is toughness. It's the ability to bounce back, especially after something that's been very difficult for you. And the fact that you're sitting here right now, in and of itself, is proof enough that you are all resilient. If you live long enough, you're sure to encounter global health crises, significant economic uncertainty, and socio-political unrest. To endure all three at the same time, to the extent that you've had to, and to do that and still be sitting here today, shows great resilience. You'll undoubtedly face more challenges in your career and your life, but you'll be served well to continue to be resilient. The next attribute may sound a little bit counterintuitive, but it comes from a quote from an author, Yuval Noah Harari, who describes the greatest scientific discovery of history. And he notes that that discovery is that of ignorance. He says that once humans realized how little they knew about the world, they suddenly had a very good reason to seek new knowledge, which opened up the scientific road to progress. This is so poignant, especially now as dogma rules the day. I encourage you to embrace your ignorance, the understanding that as much as any one person can know, it's infinitesimal compared to all that could possibly be known. There's so much we don't know about the world. You'll continue to grow and continue to learn, but don't forget that there's always more to know. Harari expanded upon his comments in a way that really hit home. He said, people rarely appreciate their ignorance because they lock themselves inside an echo chamber of like-minded friends and self-confirming news feeds where their beliefs are constantly reinforced and seldom challenged. I urge you all to keep your minds open and not only welcome challenges, but seek them out, trusting that the foundation of knowledge you have will help guide you to adapt your viewpoints or persist in your convictions. The final charge that I have, I said there'd be three. The final charge that I give you is to always be grateful. One of the most influential people in my life was a friend of mine, Desi, and he coined 3 words that would impact my life and those of countless others. His story is incredible, but for today, we'll just talk about his message. In the 10 months from when he was diagnosed with a terminal illness to when he lost the battle, Desi developed a charitable foundation and went on a national motivational speaking tour. His message was simple: we get to. He wants us to stop framing everything about what you have to do and understand that you get to do those things. It's easy to complain about going to work tomorrow, having to wake up that you go to work, but he says, be grateful that you get to go to work. Not everybody has that opportunity. A lot of the people we're working with aren't going to have that opportunity. So anytime you find yourself saying, I have to do something, just think about maybe that you get to do that thing. And that's all about gratitude. This matters to us, especially today, because we get to do so many things as physical therapists and student physical therapists. There's always challenges. It's challenging treating patients with altered cognition or dementia, but we got to help them get the most out of life. Treating patients with chronic pain could be draining, but we get to be the clinician who doesn't write them off the second they walk in the door. We get to make them feel better, if only for an hour, because it might be the only hour that week that they feel good. And we get to work in a profession where we continue to find ways to turn that hour of relief into a day, a week, a month, or a lifetime. We often treat people who are under immense stress or who are at a low point in their lives, possibly because of why they're seeing us. And we get to help ease that burden for them. We get to help others in so many ways. Sometimes those ways are not the ones that are expected, not the glorious or glamorous ones, but it does not make them any less important. We get to help people every day, each of us in different ways, and that's a beautiful thing. Over the past year or so, we, the faculty, got to watch you all grow as individuals and future clinicians. And because of that, today you get to don those white coats. And I don't want to understate that point. You get to go out into the clinic and help people. As Dr. Johnson just mentioned, there's a lot of people that want to be in your shoes right now that aren't. So you have that opportunity. Whatever arena you're in, you'll have an incredibly rewarding experiences, and indubitably, you'll have less desirable experiences. I urge you to always keep in the back of your mind what a privilege it is to be in the position you're in and to be grateful for that opportunity. So stay resilient, never stop searching for answers, and always be grateful. Do those things, and you're going to be great. And I look forward to witnessing all the great things that you'll do. Thank you.
Thank you very much, Dr. Rivera. Words of wisdom from everyone so far, right? So now we're going to hear from the alumni speaker. So from an alumnus point of view, someone who was in your shoes a few years ago, you know, but more recently than I was in your shoes, right? And thank you for laughing, I think. But coincidentally, this year's alumni speaker is also a member of the faculty who joined our faculty in the fall of 2022. So Dr. Nicholas Sheehan, PT, D.P.T, board certified clinical specialist in neurologic physical therapy, graduated from New York Medical College in 2016. And now he is going to share his perspective about being a physical therapist.
All right, well, thank you for the introduction. I'm honored to be here today, not only as a faculty member, but also as an alumni selected to give this speech. I would first like to congratulate the class of 2025 for all your achievements this far. It really is your hard work and dedication that has brought you here today. It will also lay a strong foundation for your continuous growth as you continue throughout our program and enter the field. Now, as it was mentioned, it was not too long ago that I was in your shoes as a D.P.T student. And I recall this time as a special time because there's a palpable change in mentality as you begin to exhale from completing your rigorous foundational coursework, but really prepare to take another deep breath in before your next lift, clinical education. So when I look back on my transition into the field as an entry-level clinician, I see that this program really teaches you how to think, how to approach a patient, a problem, a situation, and how to successfully function within a multidisciplinary team. Now, in my experiences with those well-established in the neurorehabilitation and research fields, as well as when I was studying for my clinical specialty, it really is apparent that the framework of thought taught here at this institution aligns there with these elite. I tell you this because at this point in time, your perspective may be limited. As a student clinician, you may be becoming anxious or nervous about entering the clinic as you begin to treat your patients. But I really want to reassure you that you know how to think and that you have a solid foundation and that you will be able to achieve great outcomes for yourself and your patients. So you've heard my colleagues speak about the white coat and transition from a D.P.T student into a developing clinician. And although this transition is in the forefront, I would like to identify another transition that has been going on since you began this journey last June. All of your hard work is no longer just for you. It is for the patients you will be treating. In our profession, we meet people in their darkest of times, whether it's after a life-altering neurologic event, chronic pain and dysfunction, or even a career-altering sports injury. And you will be there, not only as their physical therapist, but as a major foundation to their support system. Patients will look to you for treatment, for advice, and as an example of physical and mental health. Now, it may be difficult to realize this in the moment because it is easy to get lost in all the time you spend studying, analyzing and deciphering your patient cases, completing countless assignments, and spending hours in lab practicing your hands-on skills. But it is for a greater good. It's for your patients. You will help many along their road to recovery, and in some ways that you may not even realize. It is you that is the next generation of the physical therapy field, and it is up to you to continue to uphold our high professional and clinical standards. So now, based off of my path and experiences, I would like to share a few things with you I've learned along the way. 1, value education and knowledge. See everything as an opportunity and approach every situation with an open mind and desire to learn. Set goals and actively pursue learning. You have the ability to set your path and determine your future. Nothing good comes easy or without effort. 2, search for your passion. Find something that excites you. Remain passionate about your work and let your patients see it. It will contribute to their engagement and motivation as it will yours. 3, hold yourself to a high standard. Expect more for your professional and patient outcomes. Pursue things that may seem out of reach. You will surprise yourself with what it is you can achieve. 4, consider your why. Why are you performing the intervention you have selected? Why is this patient progressing or not progressing? Why is the patient here to see you and not somebody else? Why is it that you want to be a physical therapist? It is the question of why that will continue to promote a higher level of thinking and keep you grounded even in difficult times. And lastly, be human. You are entering a field where a patient case may precede your first interaction. Don't let the chart define the patient. Search to identify who the patient really is. What is it that makes them tick? And appreciate where it is they may be coming from. We are still coming off this tail end of a pandemic, and one thing that has accompanied our new normal is this new version of humanity. Human interaction has changed, and a small message of empathy and compassion can really make all the difference when establishing patient rapport and delivering patient care. So it is with confidence that I can say to you that you have what it takes to be a great clinician. The process may not come easy. There will be ups and downs, but stay connected to yourself, your values, and your patients. Pursue greatness and strive to reach your fullest potential. Thank you again, and I wish the class of 2025 all the best.
Thank you, Dr. Sheehan. So now we're moving to the portion of the ceremony where the white coats will be donned, and this will be done with the assistance of the students' faculty advisors, as well as the rest of our staff here. So I'm going to introduce the faculty who you've not yet met, and then we'll kind of stand, we'll assume our places, and then Mr. Nick Stacy-Luke will call the names of the students receiving their white coats. Okay, so Dr. Catherine Curtis actually is not able to be with us this evening. Dr. Parmveer Kashal will be here in her place. Dr. Nikki Goronsky. Dr. Victor Santamaria. Dr. Scott Rivera. And Dr. Tina Wellsome. Okay, I will join them, and this is Mr. Nick Stacy-Luke. We have 3 Nicks in our department, and it always takes me a second to remember. I know which one, but anyway.
Thank you very much, Dr. Delat. Hello, everyone. If we could hold our applause until all 6 students have donned their white coats, that would be great. Thank you. Michelle Archambault, Reina Alexander, Daisy Alvarez, Samantha Delgado, Safraz Ali, Bettina Brutus. Dave Angelo Barona, Justin Augustin, Jamie Barrett, Jeff Daniel Duro, Veronica Savivas, Peter Calicia. Good shot. Good shot. Right. Patrick Lee, Anthony Cherry, Justinian Michaels, Lauren Riccobono, Abid Shah, Wilbert Davis Jr. Tori Moore, Raymond Huang, Amit Shaw, Frank Schultz, Stephen Schifrin, Destiny Ferguson. Alexander Morales, Jacob Himowitz, Sarah Smith, Anthony Tran, Paula Suarez, Youssef Ibrahim. Dennis O'Hara, Carrie Pansler, Kennedy Tran, Whitney Torsion, Yue Tong, Gaetano Modica. Alejandra Rivas, Christina Santamaria, Maria Verderosa, Peter Valdez, Michelle Thomas, Stephen Morella. Rania Salib, Edward Wang, Jordan Vasquez, Shayla Unger, Gabriela Pagnota. Ladies and gentlemen, Romel Torres.
Thank you, Mr. Stacy Luke. Thank you, Ms. Fran Menta. And thank you, faculty. You can have a seat. I have to find my space now. So now Dr. Victor Santamaria will lead the class in the recitation of the PT oath.
Thank you, Dr. Dola. Time to read the pledge, okay, for physical therapy. It's on the back. Just in case. All right. As I enter the profession of physical therapy to practice as a physical therapist, I solemnly and willingly pledge the following. I will be trustworthy towards my patients and clients in all other aspects of physical therapy practice. I will place the welfare of my patients and clients above my own self-interest. I will provide accurate and relevant information to patients and clients about their care and to the public about physical therapy services. I will exercise sound judgment and comply with laws and regulations that govern physical therapy and protect the public from unethical, incompetent, and illegal acts. I will maintain professional competence and promote high standards for physical therapy practice, education, and research. I will address the health needs of society and strive to effect changes that benefit patients, clients, and the community. I will respect the rights, knowledge, and skills of colleagues and other healthcare professionals and seek consultation whenever the welfare of the patient or client may be advanced. Thus, with this pledge, I freely accept responsibilities that accompany the practice of physical therapy.
Thank you, Dr. Santa Maria. So class of 2025, congratulations. You have earned these coats. To all the people who offered words of wisdom, thank you very much. They're very heartfelt and we will continue to think of them as we leave today. To all of the guests who came, thank you for joining us for such an important occasion. The members of the class of 2025 really appreciate your support, and I'm sure they share that with you, but in case they don't, they really do. So tonight's the night to give applause, so a little bit more applause. First, let's give a little bit more applause to the members of the class of 2025. Let's give a round of applause for families and friends who are here, maybe some who are not here, who give such support. Let's give applause to Rabbi Fogel, Dr. Halprin, Dr. Amler, Dr. Johnson, Dr. Sheehan for joining us for this occasion. And a round of applause for all of the faculty, for Ms. Francesca Menta and Mr. Nick Stacy Luke for all of their contributions to the class of 2025. Okay, so we're going to be finishing up. I want to thank everyone so much for being with us here today and making the day so special. We really appreciate your presence. We love working with the class of 2025, and we're so pleased to be marking this day with all of you. So class of 2025, after we kind of formally wrap up, if you want to come down to the front and we'll have a picture of everyone, our guests, our words of wisdom, everyone who is part of this ceremony. For the families and friends who've joined us here today, if you like, you can exit out the back. You can get photos with your class member, you know, outside. It's beautiful outside, right on the lawn as well, too. So thank you very much. And this concludes our ceremony.